As we get older, one number suddenly seems to follow us everywhere. The number on the blood pressure monitor, at every doctor's appointment, during pharmacy checkups, even when a family member buys a home blood pressure machine, the question comes up, is my blood pressure okay? For many older adults, especially those over 60 or 70, this question can become confusing because the answers don't always seem consistent. One doctor says your blood pressure should be lower. Another says it's acceptable for your age. Friends compare their numbers. Online articles offer different ranges. And before long, many people are left wondering what they should actually believe. If you've ever looked at a reading like 138 over 82 or 145 over 78 and wondered whether you should be worried, you're not alone. The truth is that blood pressure changes with age, but that doesn't mean high blood pressure automatically becomes normal. That's one of the biggest misconceptions affecting older adults today. Many people assume that because arteries naturally stiffen over time, higher blood pressure is simply part of getting older. While aging does influence blood pressure, accepting dangerously high numbers as normal for my age can quietly increase the risk of heart attack, stroke, kidney disease, vision problems, and memory decline. On the other hand, trying to push blood pressure too low can also create problems. That's where things become more complicated. If blood pressure drops too much, especially in older adults, it may lead to dizziness, fainting, falls, weakness, confusion, or reduced blood flow to important organs. And so if blood pressure that's too high is dangerous, and blood pressure that's too low is also risky, what should older adults actually aim for? That's exactly what we'll answer today. By the end of these next several minutes, you'll understand what blood pressure numbers generally matter most for older adults, why one reading doesn't tell the whole story, and why focusing on a single perfect number can sometimes be misleading. Let's start with the question almost everyone asks. What is the safest blood pressure for older adults? For many healthy adults over 65, most experts generally recommend keeping blood pressure below 130 over 80 when it can be achieved safely and without causing side effects like dizziness or falls. Notice something important. The phrase is, when it can be achieved safely. That's because health isn't one size fits all. A healthy, active 72-year-old who walks every day and has no major medical conditions may tolerate a lower blood pressure very well, but someone who's 88, living with multiple chronic illnesses, experiencing frequent dizziness, or recovering from serious illness may need a different approach. Doctors don't simply treat numbers, they treat people. That's why the safest blood pressure isn't always the lowest possible number. Instead, it's the range that protects the heart, brain, kidneys, and blood vessels while allowing someone to feel steady, energetic, and able to live independently. Here's another important point that surprises many people. One high reading doesn't necessarily mean you have uncontrolled blood pressure. Imagine climbing a flight of stairs, rushing through traffic, drinking several cups of coffee, feeling anxious before an appointment, or simply having a stressful morning. Each of those situations can temporarily increase blood pressure. Even something called white coat hypertension can affect millions of older adults. That's when blood pressure rises inside a medical office simply because of anxiety during the visit. At home, those same people may have perfectly acceptable readings. That's why healthcare providers often recommend measuring blood pressure at home over several days, rather than relying on a single number taken in a clinic. Patterns matter much more than isolated readings. Now let's quickly understand what those two numbers actually mean. Take a reading of 128 over 76. The top number is called systolic blood pressure. This measures the pressure inside your arteries when your heart contracts and pumps blood throughout your body. The bottom number is diastolic blood pressure. This measures the pressure when the heart relaxes between beats. As people grow older, the systolic number often increases more than the diastolic number. That's because arteries gradually become less flexible with age. Think of a brand new garden hose. It's soft and flexible. Water flows smoothly through it. Now imagine that same hose after many years of exposure to sun and weather. It becomes stiffer. Water creates more pressure against the walls. our arteries experience something similar over time. This natural stiffening partly explains why isolated systolic hypertension becomes more common after age 60. That's when the top number is elevated while the bottom number stays relatively normal. For example, someone may have a blood pressure reading of 148/74. Many older adults have exactly this pattern, and it deserves attention because research has consistently shown that elevated systolic blood pressure strongly predicts stroke and heart disease in older adults. But here's another common misunderstanding. Some people panic whenever they see the systolic number above 130. Others ignore readings until they reach 180. Neither reaction is ideal. Blood pressure exists on a spectrum. Small differences matter less than long-term trends. Consistency matters. Overall cardiovascular health matters. Lifestyle matters. Medication adherence matters. And perhaps most importantly, symptoms matter. This leads us to one of the biggest mistakes older adults make. They judge their blood pressure based on how they feel. You may have heard someone proudly say, "I know my blood pressure is fine because I feel great." Unfortunately, high blood pressure often causes no symptoms at all. That's why it's sometimes called the silent killer. Someone can feel perfectly healthy while blood vessels throughout the body are slowly being damaged over many years. Conversely, another person may feel tired or have a headache and assume blood pressure is dangerously high when the reading is actually normal. Symptoms alone cannot reliably tell you what your blood pressure is doing. Only measuring it accurately can. Now let's talk about another mistake that happens every single day in homes around the world. People measure blood pressure immediately after walking around the house, or after eating, or after smoking, or while talking, or with crossed legs, or while holding the arm below heart level. These small details can significantly affect the reading. Ideally, you should sit quietly for about 5 minutes beforehand. Keep both feet flat on the floor. Support your back. Rest your arm at heart level. Avoid talking during the measurement. Take 2 readings about 1 minute apart. Those simple habits provide a much clearer picture of your true blood pressure. Another issue many older adults overlook is timing. Blood pressure naturally changes throughout the day. It usually rises in the morning, fluctuates during daily activities, and often decreases during sleep. That's why comparing today's morning reading with yesterday's evening reading may not tell the full story. Healthcare providers often recommend checking blood pressure at roughly the same times each day to identify meaningful patterns. Now here's something especially important for adults over 70. Standing blood pressure. Many people only measure blood pressure while sitting, but some older adults experience what's known as orthostatic hypotension. This means blood pressure drops significantly after standing up. When that happens, the brain briefly receives less blood flow. The result can be dizziness, blurred vision, weakness, or even a dangerous fall. Falls remain one of the leading causes of serious injury among older adults, which is why your healthcare provider may sometimes measure blood pressure while you're lying down, sitting, and standing. If you frequently feel lightheaded after getting out of bed or standing from a chair, that information is just as important as the blood pressure number itself. Now let's consider another question people often ask. Does medication automatically solve high blood pressure? Not necessarily. Medication is incredibly important for many people and has saved countless lives. But medication works best when it diffuses with everyday habits that support healthy blood pressure naturally. These include maintaining a healthy body weight, staying physically active, limiting excess sodium, eating more fruits and vegetables, getting adequate sleep, managing stress, avoiding tobacco, and limiting alcohol. What's remarkable is that even modest improvements in these areas can have meaningful effects over time. In some cases, small lifestyle changes may reduce blood pressure enough to lower cardiovascular risk substantially. Yet, many people unknowingly make choices each day that work against them. Some consume far more sodium than they realize because packaged foods, canned soups, sauces, breads, processed meats, and restaurant meals often contain large amounts of hidden salt. Others believe sea salt or Himalayan salt doesn't count as sodium. In reality, all of these contribute sodium, and excessive amounts can still raise blood pressure. Then there are medications that many people never suspect could affect their readings. Certain pain relievers, decongestants, steroids, and even some herbal supplements may increase blood pressure in susceptible individuals. That's one reason healthcare providers often ask about every medication and supplement you're taking, not just your prescription medicines. And then there's one factor that quietly influences blood pressure more than many people realize: sleep. Poor sleep doesn't just leave you tired the next day. It can also affect how your heart and blood vessels function, sometimes contributing to higher blood pressure over time. For some older adults, conditions like sleep apnea play an important role, yet they remain undiagnosed for years because the symptoms aren't always obvious. Some people assume loud snoring is the only sign of sleep apnea, but that's far from the whole picture. Waking up with a dry mouth, feeling unusually tired despite spending enough hours in bed, morning headaches, difficulty concentrating, or a partner noticing that your breathing briefly stops during sleep can all be clues. Left untreated, sleep apnea can repeatedly lower oxygen levels during the night, placing extra strain on the cardiovascular system and making blood pressure much harder to control. This is one reason doctors sometimes become concerned when someone is taking 2 or 3 blood pressure medications and their readings remain high. The medication may not be the entire issue. There may be another condition quietly working against it. Another hidden factor is dehydration. Many older adults intentionally drink less water because they're worried about frequent trips to the bathroom. While that concern is understandable, inadequate hydration can sometimes contribute to dizziness, especially when standing, and may complicate blood pressure management. Certain medications, including diuretics, often called water pills, can increase fluid loss even further. This creates a delicate balance. Too much fluid may not be appropriate for someone with certain heart or kidney conditions, while too little fluid can leave another person feeling weak or lightheaded. That's why individualized medical advice is so important, particularly if multiple health conditions are involved. There's another number that doesn't receive nearly as much attention as it should. It's called pulse pressure. Pulse pressure is simply the difference between the top number and the bottom number. For example, if your blood pressure is 150/70, your pulse pressure is 80. As arteries become stiffer with age, this gap often widens. A larger pulse pressure can sometimes provide additional clues about the health of the blood vessels. While it's not something most people need to calculate every day, healthcare providers often pay attention to it because it can help paint a more complete picture of cardiovascular health. Another overlooked measurement is your resting heart rate. Although heart rate and blood pressure are different, they work together. A consistently elevated resting heart rate may reflect stress, illness, certain medications, poor fitness, dehydration, or other medical conditions. Looking at both numbers instead of only one often provides more useful information. Now let's talk about timing after starting treatment. Many people expect immediate results. They begin a medication on Monday and become discouraged if Tuesday's readings aren't perfect. Blood pressure doesn't always respond overnight. Some medications require days or even several weeks before their full effect becomes clear. Lifestyle changes are even more gradual. Eating healthier for 2 days doesn't erase years of elevated blood pressure, but steady improvements over months can produce meaningful benefits. Patience is an important part of successful blood pressure management. That doesn't mean ignoring persistently high readings. It means understanding that safe, lasting improvement usually happens over time rather than instantly. Another common mistake is checking blood pressure too often. It may sound surprising, but repeatedly measuring every 15 or 20 minutes can actually increase anxiety. The stress of constantly watching the numbers rise and fall may temporarily elevate blood pressure even further. Instead, many healthcare providers recommend following a consistent schedule unless instructed otherwise. For example, measuring in the morning before medications and again in the evening for several days often provides much more useful information than dozens of scattered readings throughout the day. Keeping a simple written log can also reveal patterns that memory alone often misses. Perhaps readings are consistently higher after poor sleep. Maybe they're lower on days when you take a walk. Perhaps weekends look different from weekdays. These patterns help both you and your healthcare provider make better decisions. Now consider physical activity. Many older adults become nervous about exercising after being told they have high blood pressure. They worry that movement will push their numbers dangerously high. In reality, regular physical activity is one of the most effective non-drug ways to support healthy blood pressure for many people. During exercise, blood pressure naturally rises to meet the body's increased demand for oxygen. That's completely normal. After exercise, however, blood pressure often drops below its usual resting level for several hours, a response sometimes called post-exercise hypotension. Over weeks and months, consistent activity can help lower resting blood pressure. The key is choosing activities that match your health status. For many older adults, walking, swimming, cycling, gentle strength training, or low-impact aerobic exercise are excellent options when approved by their healthcare provider. On the other hand, suddenly attempting extremely intense exercise after years of inactivity may not be appropriate. Progress matters more than perfection. Even adding 10 or 15 minutes of movement most days can make a meaningful difference over time. Strength training deserves special attention because many people mistakenly believe it's and only for younger adults. Maintaining muscle mass supports balance, independence, bone health, and metabolism. Stronger muscles also make everyday activities like climbing stairs, carrying groceries, or getting out of a chair feel easier. However, proper breathing during strength exercises is essential. Holding your breath while lifting heavy objects can cause a temporary spike in blood pressure. Exhaling during the effort and avoiding unnecessary straining can reduce that effect. Let's also discuss stress. Stress itself isn't always harmful. The body is designed to respond temporarily to challenging situations. The problem occurs when stress becomes constant. Financial worries, caregiving responsibilities, chronic illness, loneliness, grief, or ongoing anxiety can keep stress hormones elevated for long periods. These hormones can contribute to persistently higher blood pressure in some individuals. Simple stress management habits won't replace medication when medication is needed, but they can complement treatment. Deep breathing, spending time outdoors, maintaining social connections, engaging in hobbies, practicing relaxation techniques, and getting regular physical activity all support overall cardiovascular health. One area that's frequently underestimated is loneliness. Research has shown that social isolation isn't just emotionally difficult, it can also influence physical health. Older adults who maintain meaningful relationships often experience better overall well-being than those who spend long periods completely isolated. Another important topic is nutrition. Many people focus entirely on what they need to eliminate. Less salt, less sugar, less processed food. While reducing excess sodium is certainly valuable, adding beneficial foods is equally important. Potassium-rich foods, when appropriate for someone without certain kidney conditions, can help balance sodium's effects. Fruits, vegetables, beans, yogurt, and other nutrient-rich foods contribute vitamins, minerals, and fiber that support cardiovascular health. However, this comes with an important warning. Not everyone should intentionally increase potassium. Individuals with chronic kidney disease or those taking certain medications may need to limit potassium instead. That's why copying someone else's diet without considering your own medical conditions can sometimes do more harm than good. Another misunderstanding involves caffeine. Some people are extremely sensitive to it, while others experience very little effect. A cup of coffee may temporarily raise blood pressure in certain individuals, particularly if they don't consume caffeine regularly. If your healthcare provider suspects caffeine is affecting your readings, they may recommend avoiding coffee, tea, energy drinks, or caffeinated soft drinks for about 30 minutes before checking your blood pressure to obtain a more accurate measurement. Then there's alcohol. Some people believe a nightly drink is harmless for everyone. The reality is more nuanced. For some individuals, excessive alcohol intake can contribute to higher blood pressure over now, and may also interfere with medications or increase the risk of falls, especially in older adults. Smoking deserves mention as well. Every cigarette causes blood vessels to narrow temporarily, increasing the workload on the heart. Even though the blood pressure increase may not last forever, repeated exposure over many years contributes significantly to damage within the cardiovascular system. Quitting smoking at any age offers measurable health benefits. Blood vessels begin responding positively much sooner than many people expect, and the risk of cardiovascular disease gradually declines over time. Finally, it's important to recognize that the safest blood pressure isn't determined by a single office visit or 1 week of home readings. It reflects an ongoing balance between protecting vital organs, preserving quality of life, minimizing medication side effects, and reducing the likelihood of serious events like stroke or heart attack. Achieving that balance often requires adjustments along the way because the body's needs can change with age, new medical conditions, or even seasonal differences in activity and health.